MDRO focal person, National TB and Leprosy Control Program, Dr. Kunle Babawale, joins me on the news from our Abuja studio to discuss this. Good to have you join us, Dr. Babawale. So help us, there's some sort of controversy. The World Health Organization says that Nigeria has only detected about 27% of its estimated incident cases in the country. But the Nigerian government says it has met about 79% case finding in 2019. Give us an honest assessment of where we are as a country in terms of detecting tuberculosis cases. I want to be sure that you can hear me, Dr. Babawale. If you can hear me, please say something, just to be sure.
Yeah, I can hear you. Although there was a break initially, but I think I can
All
hear
right.
you
So
now.
my question is that the World Health Organization says that Nigeria has only detected about 27% of its estimated TB cases. But the Nigerian government says it has detected about 73%, if I'm right, of case finding in 2019. So I just wanted you to give us an honest assessment of where we are in terms of detecting cases.
Can hear. You can. Yeah.
Can you hear me?
Yeah, I can hear you now. Can you repeat?
All right. So where do you think we are in terms of detecting cases in Nigeria, TB cases?
Oh, okay. Thank you very much. Like you said, we're celebrating the World TB Day today, March 24th, which is a day recognized globally for commemoration of the World TB Day. And I would like to say categorically that Nigeria ranks first in Africa in terms of tuberculosis disease burden, and we are 8th globally in terms of the burden of disease in the whole world. Now, it is estimated from the WHO Global TB report that Nigeria has a prevalence of 210 per 100,000 population for TB, which simply means in absolute number, we have an estimated 414,000 TB cases in the country annually. And out of these 440,000 cases, we have been only able to detect 138,500 as at the end of 2020, which gives us approximately 35% case detection. What does that mean? That means we still have about 60 to 65% cases of TB left undetected. It shows that we are only detecting 1/3 of the total number of cases of TB we have in this country. That is really dangerous for us as a country. It means that we have 2/3 of cases out there still spreading the infection. And I think all hands must be on deck to make sure that we find these cases and then we place them on treatment.
So by your assessment, we have now, you said 60-65% left, which means we have done 35-40%. But we also know that people generally have an attitude towards, visiting the hospital. So what can we do in terms of behavioral change, advising people to, when you have a cough that is prolonged, go to the hospital? What can we do in that regard?
Okay, thank you very much. I think what we need to do is to create awareness. Because people still have a lot of wrong information about what tuberculosis is all about. Some think it's a spiritual thing. Some really don't know what this is all about. If you go to the rural area and you ask people what is tuberculosis, a lot of them you'll discover they can't really understand what TB is, which shows that the awareness is very, very low. For example, look at COVID or HIV. If you go on the street and ask somebody, have you heard about coronavirus? You say a lot of information, they know about it. But a lot of people don't know about TB. But unfortunately, people fail to realize that TB, from the mortality index, we have about 164,000 deaths from tuberculosis every year, annually, which means that the mortality rate is really, really very high. And you see that because it's a chronic disease, it's a chronic infection that does not kill its victim immediately. You know, people fail to realize how deadly the disease is. But the good news is that the federal government of Nigeria, in collaboration, that's the Federal Ministry of Health, in collaboration with partners like the Global Fund, the USAID, has gone a long way in ensuring that people have access to diagnosis, treatment, care, and support. One, by way of ensuring that the Gene Expert machine, because we have the Gene Expert machine, which is a rapid diagnostic tool, okay, for which we can be able to diagnose cases of TB as quick as possible within 1 hour, 30 minutes. It's available in the country, and we have about 403 Gene Expert machines in Nigeria right now. The target is to make sure that we have at least one Gene Expert machine in every local government so that people can easily assess, you know, diagnosis. And then for treatment, we have over 12,000 treatment sites all over the country, both in the primary healthcare, in the general hospital, and also in the tertiary facility. You know, we call it the DOT center. That's the TB treatment center, where people can easily access treatment, care, and support. So what we're trying to say is that we need to spread the awareness so that people know that people don't need to die of TB, because TB is curable.
All right.
The diagnosis is free. The treatment also is free.
All right.
So there is no reason why anybody should die of TB.
Absolutely.
So we want to make sure that the awareness is created and that people should access diagnosis, treatment, care, and support.
And we hope that they can hear you and begin to do that, because really, like you said, people don't have to die of TB. But I'm afraid we do have to leave it there. MDRO focal person, National TB and Leprosy Control Program, Dr. Kunle Babawale, thanks for talking to us.